In part 5, in the topic of HRCT, reticular opacities, we are done with the smooth thickening of interlobular septa, the nodular interlobular thickening. Now we're going to talk about the irregular thickening. It's better to describe the irregular interlobular septal thickening by irregular reticulation. Why? Because we have two types of lines or septation. We have the interlobular septa and we have the intralobular lines. The boundaries of the secondary pulmonary lobule are the interlobular septa. The reticulation within the pulmonary lobule, which hold the pulmonary lobule, called intralobular lines. In case of fibrosing lung disease, you cannot differentiate between irregular intralobular lines and irregular interlobular septa. Both together give the appearance of irregular reticulation. Irregular reticulation reflects there is a fibrosing process involving the lung. Usually, it is a secondary or ancillary finding to honeycombing and traction bronchiectasis. But if presented per se alone without the other pulmonary features of honeycombing traction bronchiectasis, we will have a limited differential diagnosis. I suggest to report in conclusion, we have chronic fibrosing interstitial pneumonia for differential diagnosis of indeterminate UIP pattern, fibrosing NSIP pattern, or indeterminate for fibrotic HP pattern. Here we have case having irregular reticulation at the periphery with subtle and subtle ground glass opacities, and here the reticulation are extending inward to the lung. No big difference here. Both are indeterminate for UIP, indeterminate for fibrotic HP, and fibrosing NSIP. But suppose you have subpleural sparing, so you will favor NSIP over the other two possibilities. Or if you have the hexagonal pattern, that the irregular reticulation are extending inward, forming the hexagonal pattern into 2 or 3 layers inside in the lung to the periphery, forming the drawing of the pulmonary lobules. So this can suggest the indeterminate for fibrotic HP over indeterminate for UIP or fibrosing and NSIP. This was the end of the part 5. In part 6, we'll give this summary and some of miscellaneous cases, including the smooth, nodular, and irregular septal thickening and their differential diagnosis as a cases. And thanks for your attention.